Thank you, Eddie. Thank you, everybody.
We have one more presentation before we jump to the Q&A, and Leandro and I have a series of questions already ready to present to ask the faculty. And in order to save time, because we might go over a little bit, and we will extend the webinar over the 1 hour just to accommodate the Q&A, we immediately now jump all the way across the world to beautiful Hangzhou in China to understand, for those who are not that good in command of the English language, how can we help them to remove barrier to publication in international journal that require the English language to be used. So let's jump to Lu Xiaomin, a senior clinical engineer at the Red Cross Hospital in Hangzhou, China.
Good evening, Jacqueline. Good evening, Leandro. Hello, everyone else, my dear colleagues. Nice to meet you online. I'm Lu Xiaomin from China. I'm working in Hangzhou Red Cross Hospital. I'm going to talk briefly about China clinical engineer incentives and barriers in publishing CE learning and growth experiences. Hangzhou locates on the east coast of China. Hangzhou Red Cross Hospital, formerly known as the French Catholic Hospital, was founded by a nun, Saint Gare, in 1922 as the charity hospital. It is a 1,000-bed hospital with 1,650 staff, 42 clinical departments. The picture below was taken by a drone above the city moat nearby the hospital. The Catholic Church in our hospital is protected as a cultural relic now. And that's the outpatient area. Speaking of the barriers in publishing English papers, first thing that I can think of will be the language. Since we don't have an overall data concerning CE in China, let me explain these data which come from an app called Good CE, developed by China Medical Device Journal. It covers more than 7,000 hospitals in China and 47,000 registered users. Among all the users, half of them are clinical engineers. The others are doctors, nurses, staff from the X-ray, ultrasound, and pharmacy, etc. It means people from different departments are concerned with clinical engineer, meaning the effectiveness and safety of healthcare technology. And that looks really good. And 53 of the users are with engineer or senior professional titles, which would also mean that 47% junior titles or less. These percentage of people might be not as good in English. Now, from this app, we can see updated information from the e-magazine including China Medical Device and Global Clinical Engineering Journal. We can actually see some of the articles are getting more visits than others, which means they are pretty welcome. But still, there could be more hits. It's in English right now. Some people are working on it to bring us a Chinese version. We're supposed to exchange technological information, and language shouldn't be a barrier anyway. So I think the Chinese version of Global Clinical Engineering Journal must be very welcome. And if someone can constantly provide English-Chinese, Chinese-English translation, or consultant service for Chinese clinical engineers in writing English papers, it would help greatly. CE in general is referred to clinical engineers in healthcare facilities. But broadly speaking, R&D personnel in production enterprises and maintenance technicians in service companies are all clinical engineers. These people are usually very good at their job. Do they get all the information about the magazine? What about the graduate students from colleges and universities? They could major in basic discipline as biomaterial or AI that are strongly related to the future of healthcare technology. Doctors and nurses, users of healthcare technology, origin of innovation should also be involved. What I'm trying to say is more people, more participation, more input. Everybody is facing this problem, what to write. So am I. We're supposed to write something original, something with evidence, something significant. Now, let's watch a video.
He sets his sights on one of the world's most famous inventors. Thomas Edison has been a renowned innovator since the age of 19. He first made his name by perfecting the telegraph, before going on to invent the stock ticker and the phonograph. In his lifetime, Edison will secure over 1,000 patents. But now, at 31, Edison is on the verge of his greatest innovation yet.
Edison had that unique ability to sort of look at this thing, then figure out how to use it.
You may ask, what are we supposed to write if our everyday job is merely solving some ordinary problems and routine quality control? Of course, we should follow the routines. You can't expect everyone to be Thomas Edison. But while facing problems, be creative. What changed the world so greatly in the last 100 years? Positive thinking and willingness to improve. Like Steve Jobs said, stay hungry, stay foolish. The opportunity lies in how you see challenge, in keeping studying and generating new ideas. In some part of China, innovation consortiums are set up to link different people all together to share information and resources. They are clinical engineers and medical staff from hospitals. They are from research companies who need demand and new ideas from healthcare workers as well as help them to build a prototype. They are from administrative departments and universities who will instruct people on methodology and on how to submit an application for a patent. The way they share information and support each other is so inspiring. Last year in Zhejiang province, 26 innovative projects were rewarded during the annual academic conference of clinical engineers. This year, innovative projects are being collected across China by CMAS, Chinese Medical Association Clinical Engineering Branch. A bigger network is needed to help each other solve problems in the clinic to improve safety and quality of healthcare. Let articles be the spark of wisdom and cooperation. This could be one of the approaches on the question, what to write. Global Clinical Engineering Journal is 2 years old. It has been rated Diamond Open Access Journal. We surely hope that this journal, as the voice of global clinical engineers, be one of the SCI indexed journals, so as to encourage clinical engineers to publish articles. Thank you.
Very nice, very clear point. coming from Hangzhou, China, by Xiaomin Lu.